Hello everyone, my name is Anna Petrova.
My name is Alexandra Буганова.
We are the students of the first year, the second group of Saratov State Medical University. And now we will tell you about the latest medicines for the treatment of kidney diseases and their complications. The relevance of the problem. Kidney diseases occupy a special place among chronic non-communicable diseases today. They are widespread, asymptomatic at an early stage, which is why patients don't turn to the doctors for treatment. They progress rapidly and contribute to a sharp decrease in the quality of life, and in the terminal stage lead to the need of expensive methods of substitution therapy, such as dialysis and kidney transplantation. Epidemiological studies show that up to 14% of the world's population have chronic kidney disease. One of the serious complications of chronic kidney disease is renal anemia, which directly affects the severity of asthenic syndrome in patients, or the tolerance of physical activity, the effectiveness of intelligence, and the strength of immunity. With development of chronic kidney disease, anemia also progresses. The reason is a drop in the synthesis of erythropoietin, the growth hormone of erythrocytes, in damaged nephrons. According to experts, renal anemia occurs in 90% of patients. Meanwhile, the prevention and correction of anemia directly affects the severity of symptoms in chronic kidney disease, increases the effectiveness of treatment, and improves the quality of the life. Therefore, the development of new medicines that can fight kidney disease and renal anemia is currently very important. Today, we will tell you about several drugs development in America and Russia. The first one is desdovrok. Desdovrok or daprodustat tablets are used to treat anemia that is caused by chronic kidney disease in patients who have been on dialysis. Desdovrok is used to reduce or avoid the need to have red blood cells transfusions. The drug was approved by the FDA in 1992. So, how does it work? Chronic kidney disease patients may need dialysis, which is treatment that filters the blood and removes excess fluid. Kidneys also produce a hormone called erythropoietin, which tells the body to make red blood cells. When patients with chronic kidney disease are on dialysis, their kidneys often cannot produce enough erythropoietin, and this means their number of red blood cells becomes low. Desdovrok treats anemia by increasing the levels of erythropoietin, which messages the body to make more red blood cells.
The second one is rovulizumab. This drug is used to treat a blood disease called paroxysmal nocturnal hemoglobinuria, APG, as well as in the treatment of atypical hemolytic uremic syndrome. Also, there are studies showing the effectiveness of this drug in some oncological diseases. Unlike analogs that were synthesized early and actively used now, rovulizumab is administered one time in 2 months, which greatly simplifies the treatment process and improves the compliance of patients, especially children. The drug was improved in 2006, but for the treatment of kidney disease began to be used not so long ago. The third one is eculizumab. A biological analog of the drug eculizumab was created in Russia. The Russian biosimilar was first registered in 2019. The biosimilar developed in Russia has an improved safety profile due to the use of a more modern cellular platform and effective cleaning methods. Eculizumab in 80% of cases relieves the patient from the need for lifelong dialysis in 80% of cases from damage to the walls of blood vessels. The introduction of eculizumab into medical practice changed the fate of patients, reducing the risk of death by 80% and significantly improving their quality of life, improved the results of kidney transplantation in end-stage chronic renal failure in patients with ASD. The drug has an excellent safety profile, and its production in Russia has significantly reduced the cost of treatment and increased the number of patients who can be prescribed modern therapy. Conclusion. Since the development of new medicines allow people to fight many serious diseases, increase the expectancy, and most importantly, improve its quality. Of particular importance are medicines that help patients with chronic disease, such as chronic kidney failure, because such diseases determine a person's lifestyle. Thanks for your attention. Goodbye.